Ankle and foot cheat sheet bones and joints tibia and fibula support weight, stabilize the ankle. Example: a fractured tibia from a fall can cause severe pain and inability to bear weight. Talus transfers weight from tibia to foot. Example: talus fractures from high-impact injuries can cause swelling and difficulty moving the foot. Calcaneus, heel bone absorbs shock. Example: a heel fracture from jumping from a height can result in bruising and intense heel pain. Tarsals, 7, metatarsals, 5, phalanges, 14 form structure, aid movement. Example: metatarsal stress fractures in runners cause gradual onset pain. Joints: talocrural joint, ankle joint, hinge joint, dorsiflexion and plantar flexion. Example: limited dorsiflexion in ankle sprains can cause stiffness. Subtalar joint, inversion and eversion. Example: subtalar joint arthritis leads to difficulty walking on uneven surfaces. Movements and muscles: dorsiflexion, tibialis anterior. Example: foot drop due to nerve injury can cause difficulty lifting the foot. Plantar flexion, gastrocnemius, soleus. Example: Achilles tendon rupture leads to loss of push-off power. Inversion, tibialis posterior. Example: overuse can cause posterior tibial tendinitis, leading to arch pain. Eversion, peroneus longus and brevis. Example: weakness in these muscles can lead to ankle instability. Ligaments and stability: medial, deltoid, ligament, prevents eversion sprains. Symptoms: swelling on the inside of the ankle, difficulty bearing weight. Lateral ligaments, ATFL, CFL, PTFL prevent excessive inversion. Symptoms: lateral ankle pain, bruising, instability. Plantar fascia, supports arch, absorbs shock. Symptoms: sharp heel pain, especially in the morning, plantar fasciitis. Common injuries: ankle sprain, torn ligaments, common in inversion. Symptoms: swelling, bruising, difficulty walking. Achilles tendinitis, overuse injury, pain in the Achilles tendon. Symptoms: heel pain, stiffness, tenderness along the tendon. Plantar fasciitis. Heel pain due to inflammation. Symptoms: sharp pain under the heel, worse in the morning. Fractures: tibia, fibula, or metatarsals due to impact or stress. Symptoms: severe pain, swelling, inability to bear weight. Gait cycle: heel strike, heel makes initial contact. Example: weak dorsiflexors may cause foot slap. Foot flat, entire foot contacts the ground. Example: loss of plantar flexor strength can delay this phase. Mid-stance, body weight shifts over the foot. Example: weak arches may cause excessive pronation. Heel off, heel lifts as push-off begins. Example: calf weakness reduces force production. Toe off, toes push off the ground. Example: pain in the ball of the foot, metatarsalgia, can hinder this phase. Arches of the foot: medial longitudinal arch, shock absorption. Example: flat feet cause overpronation and arch pain. Lateral longitudinal arch, stability. Example: high arches may lead to ankle instability. Transverse arch, foot flexibility. Example: weakness can contribute to metatarsalgia. Transverse arch, foot flexibility. Example: weakness can contribute to metatarsalgia. Nerve and blood supply: tibial nerve, posterior leg, plantar foot. Symptoms: tarsal tunnel syndrome causes burning foot pain. Common fibular nerve, lateral and anterior leg. Symptoms: foot drop due to nerve compression. Dorsalis pedis artery supplies dorsum of foot. Symptoms: poor circulation leads to cold, pale feet. Posterior tibial artery supplies plantar foot. Symptoms: blockage can cause pain and numbness. Quick tips: dorsiflexion equals tibialis anterior, weakness equals foot drop, plantar flexion equals gastrocnemius insoleus, weakness equals reduced push-off, inversion equals tibialis posterior, weakness equals flat feet, eversion equals peroneus longus and brevis, weakness equals ankle instability, medial ligaments prevent eversion injuries. Deltoid ligament sprain, lateral ligaments prevent inversion injuries. Common in ankle sprains.